So what's your name?
My name is Ron.
And Ron, what do you do for a living?
I work as a physical therapist.
And where are you practicing right now?
I'm practicing in the Philippines right now. We have 15 clinics, and I manage all of it.
Okay. And how long have you been practicing as a physical therapist?
I've been practicing as a physical therapist for a total of 16 years.
Okay. And how did you hear about ASTR?
I heard about ASTR during a LinkedIn conversation. I met Dr. Jacobs there, and I gave him a call first before I even signed up for his program. And it turned out really well during our conversation, so I decided to fly over from the Philippines to California.
Okay, and up to this point, what had you been using in your practice? What methodologies?
We've been using a lot of manual therapies in our practice, some soft tissue mobilization, spinal nip, dry needling, and all sorts of stuff.
Okay, so what kind of drove you to the point of deciding to sign up for the class?
I saw the results that he's posted, Dr. Jacobs has posted. I'm impressed that a practitioner has posted something without cutting in between videos.
Okay.
And then that convinced me that, hey, you know what, this is something extraordinary, something that probably I have not seen, even though I'm a workshop junkie.
Okay. So you've been in the class now for 4 days, and as you're getting ready to leave, what are your final thoughts about the class itself that you've taken with Dr. Jacobs?
I feel that it changed a lot of the things that I thought were great. I think I'm going to be changing the type of treatment models that we'll be using in the clinic. We'll be using the biopsychosocial model that we discussed during the whole seminar. I feel that that's the best way to go about things.
Okay. And what is the biopsychosocial model? If you could just briefly talk about that.
Should I tell?
Yeah. Well, in your words, how would you describe it?
Yeah, I feel that the biopsychosocial model is a very complete assessment of a person, not just their problem, back pain or knee pain, but also their lifestyle, their habits, their total health, their total wellness. So it's like a one-stop shop for physical therapists that has not been discussed in the past.
Okay, and this is not something you learned. Did you learn about this when you were in school, or is this something that's kind of new to you as a therapist?
It's totally new to me. Although I've read a lot of stuff about nutrition, about psychology and all that stuff, but a lot of these materials are very new to me.
Okay, and with Dr. Jacobs teaching, do you feel like he is proficient with his material as he's presenting?
He's very proficient. His knowledge is really solid, and he's really anal about his stuff, and either you get it or he'll make you get it.
Okay. So have you had any treatments? Were you in pain, or did you have them work on it? Like, was Dr. Jacobs working on with you, or other practitioners here working on you with any issue that you had when you came? Have you had an ASTR treatment yet?
Yeah, I received an ASTR treatment from Dr. Jacobs yesterday.
Okay.
I had this problem since 2007 where I fractured my foot. Never really paid attention to it. I did a lot of laser, shockwave, and all sorts of stuff because my foot is not moving well. Apparently, I'm just addressing the inflammation part.
Okay.
So he worked on me yesterday using ASTR, and
what specifically did he work? Did he do scar tissue release?
He did all of it.
Fascia, everything.
He did fascia, scar tissue, fibrosis, and my foot, even today, it's equal to my other leg.
Okay. So what do you think about the treatment that you received? Do you have no pain, but just better mobility?
Yeah, there wasn't any pain to begin with, but the mobility was really bad.
Okay.
I was expecting I would get a few degrees, but I've gotten close or almost normal right now on this leg.
And that was with one treatment?
That's just one treatment. I mean, he just demonstrated it. It's not like he treated all of it. So.
Okay. Now, for you, having finished, you're almost getting ready to complete the 4-day training. How do you feel starting treatment with your patients? Do you feel like you have learned and are competent to start, practicing right away when you go home?
Yes, I feel that I could apply this right away in the clinic. Like, it's like you're hitting the ground running with the way he taught the materials. I feel that ASTR has a very big place in our practice in the Philippines. Like I said, we'll be patterning or we will be modeling our treatment models based on ASTR from here on out.
Okay, and what would you have to say to any other colleague that's listening, either occupational therapists, PTs, chiropractors, assistants, what would you say to them about ASTR, the class itself, and then also the treatment?
The class is solid. The treatment it's something that would change your practice. Like I said, I flew from the Philippines to come to California because it's really that good. You don't have to be an education junkie to appreciate what Dr. Jacobs is teaching. I feel that every physical therapist should know about this. The opportunity is here in the United States. You don't have to travel far, unlike me. So I feel that if there's a next seminar that physical therapists, chiropractors, wellness professionals should actually join in and see for themselves.
Thank you so much.
Salamat.